Hi, this is Scott with St. Alphonsus. I'm going to be going over the assembly of the FluxMed esophageal balloon catheter. Now, this particular esophageal balloon comes with two silicone plugs. You'll want to use the smaller one, which will attach to the end of the catheter. And then the opposite end of that silicone is going to attach to the light blue port on the ventilator. Next, you're going to take the opposite end and attach the stopcock to the balloon. As you can see, there are centimeter marks for measuring the proper depth, as well as making sure that the catheter stays at that correct depth. Make sure you insert the catheter as you would insert a gastric tube, and yes, the gastric tube can stay in place. With this stopcock, each knob will point to it being open. Check to make sure the balloon will hold air by turning the stopcock sideways, and then insert 10 mils of air. Then you're going to press slightly to make sure it does not deflate. Then remove all of that air to aid in insertion. In order to verify proper placement, an X-ray must be taken. Now, after the catheter has been verified by X-ray, you will need to remove the guide wire. Removing this guide wire will allow for the catheter to remain in place if the need for an MRI occurs. We have also found that the plastic at the Y has a tendency to crack and can affect the readings. So we have found it to be best to remove all of it. So this is the starting screen that we commonly use at our hospital. This is on a Hamilton C6 ventilator. So first, we're going to adjust your waveforms so that you're able to see the esophageal pressure. And then we're also going to be selecting the transpulmonary pressure. So you're going to see these specific waveforms here. Next, after the catheter has been inserted into the patient, and again, you will get that X-ray, you'll insert 10 mils of air, and then to help verify proper placement, we're going to perform what is called the Bator maneuver. Now, what that involves is you press in on the patient's stomach and you'll see every time you press in on the stomach, you'll see these increases in pressure on that esophageal pressure waveform. Once you've confirmed placement and you've actually seen those increases in pressure, then you can pull back on the catheter itself until cardiac oscillations are observed. Now, just to warn you, the respiratory rate was decreased temporarily to better observe the proper placement. Afterwards, we did increase the rate back up, and you're still able to see all those cardiac oscillations. Here, that's what these little bumps are, is those cardiac oscillations. This patient was around a 90 heart rate, so you can actually see it's a little bit quicker. If they do have a really fast heart rate, it's going to be really difficult to see these. So it'll take a lot. And here, again, those little cardiac oscillations on all of the breaths. Now, just as a disclaimer, this is currently the method we use at this hospital and have adopted this process through a lot of cases. Please check with your hospital's policy and follow their instructions for their recommended volumes of air. Now, with that disclaimer in place, in order to check for transpulmonary pressures, you must first inflate the balloon with 10 mils of air. This will remove any folds and allow you to obtain a more accurate reading, and then you're going to remove that 5 mils of air. Next, turn that stopcock 180 degrees, so it's off to the syringe, and that's when you're going to be performing your measurements. Once all the measurements have been performed, then you can turn the stopcock back and remove all of the air. At this point, you can either leave the syringe attached or you can remove it and leave the catheter open to air. Now, as far as your measurements go, you're going to be first performing an expiratory hold. The ideal measurement, so we're going to be looking at this transpulmonary pressure, is what we're looking at. The ideal measurement for this is going to be 0 plus or minus 2. Now you kind of look at that going, great, what does that mean? Well, this is going to be showing your ideal PEEP, is what this is. If it is at 0 or that plus or minus 2, then your PEEP is right at the correct level. If it is measured at a -5, that means that you will need to increase your PEEP by 5 to get it up to that 0. If you have a +5, then your PEEP is too high, and then you need to actually decrease it. After that, you're going to be performing an inspiratory hold. Now for this, we are looking for anything less than 25. If it is above 25, this will indicate that your tidal volume is too high and will need to be decreased. Now, after completing both measurements, make sure that you deflate the catheter. Doing this will actually help with making sure that it does not cause harm to the patient and that balloon will actually keep from popping or causing it to have a leak. So, thanks for watching.